Hey guys, welcome back to my channel, and today's video is about the best time to call the nurse when your family is in a nursing facility, and please remember to share, like, comment and subscribe. So many people don't know this, but every nursing facility has a unit manager. They oversee all patient care and should be able to update you about your family. The unit manager is the one that you should be calling for updates about your loved one. The nurse should not be disturbed unless you can't reach the manager or it's an emergency. Remember, call the unit manager first. If in case you can't get to them, I'll break it down for you the best time to call the nurse. So here's a breakdown of how a general shift from 7 o'clock a.m. to 11:30 p.m. at night goes. The nurse arrives at her unit and received a shift report. This may include report on 20 to 40 patients depending on what facility they are employed. The nurse is informed about the patient's background history, diagnosis, new orders for the patient, their diet, how they take their meds. The nurses do a narcotic count. The nurse proceed to start taking vital signs, but not so fast, because breakfast has arrived, so the nurse have to multitask, because you have to check all the trays to make sure the name of the patient and diet match up to make sure they have the right meal. Consistency and does not get the wrong food for patient who have allergies, gluten-free, lactose intolerant. The nurse also have to assist with feeding. After breakfast, med pass is started. This is just a list of some of the diagnosis that nurses give meds for. After med pass, nurses try to do some of the treatments for patients who have wounds, surgical incisions, skin tears or wound vacs. Also have to do body audits. Okay, at this time at 11 o'clock a.m. the nurse wants a break. But if there's a discharge, most patients get discharged at 11 o'clock a.m. Most patients get discharged at 11 o'clock a.m. The nurse has to sit with the patient, discuss their home safety, how to take their meds at home, and we also call the pharmacy to order their meds for them before they leave. Around this time, if you don't have a discharge or an admission, break. 11:30 time to check the blood glucose of patients who are diabetic, and on the screen is just to show you right here a list of the standard sliding scale of how much units some patients receive depending on how much blood sugar is. 12 o'clock lunch trays arrive. Again, the nurse must check all trays and match the patient's name to the diet to make sure they have the right consistency and make sure they don't get any food they are allergic to, and assist with feeding. The green blocks are labeled for a good time for family member to call. Now I know you're wondering, it says lunch right there. Well, nurses try to take lunch at 1 o'clock to 1:30 p.m., but that's by chance, and if there's no admissions, because that is also a common new admit time slot. After the 1:30 p.m. it's time to give afternoon meds, and again this is just a small list of some of the diagnosis that nurses give meds for. Then at 2:30, a nurse check any results of x-rays, blood or urine sample that was drawn, and notify the doctor of the results and get any new orders. Look what time it is, oh my goodness. While trying to chart on patients, it's now 3 o'clock p.m. and the nurse have to give report to the oncoming nurse.